So I'd like to welcome everybody to the COVID-19 community update for December the 11th, 2020. As regional chair, I declared a state of emergency on March 25th, 2020 under the Municipal Emergency Management Act. This declaration remains in full force and effect. And under this act, I have initiated the creation of a vaccine distribution task force that will be led by the Waterloo Regional Police Services Deputy Chief Shirley Hilton. Thank you to Chief Larkin and the Waterloo Regional Police Service for your collaboration and partnership, and especially to Deputy Chief Hilton for accepting this task. In addition to Dr. Wang, I welcome Deputy Hilton to our panel this morning. On a call with the Premier earlier this week, he and General Hillier discussed Ontario's lead in the COVID-19 vaccine distribution and what will be the largest logistical undertaking of our country in the last generation. The Waterloo Regional Vaccine Distribution Task Force will ensure that efficient, equitable plan is in place for the delivery of the immunization program, starting with our high-risk populations as determined by the Government of Canada. It will bring together a number of community partners and will take guidance from the provincial task force in the planning and delivery of the immunization program across Waterloo Region. This task force includes Bruce Lauckner, Region of Waterloo CAO, Deputy Chief Shirley Hilton, Waterloo Regional Police Service, Richard Hepdip, Waterloo Fire Chief, Dr. Hsiu-Li Wang, Regional of Waterloo Medical Officer of Health, Karen Quigley-Hobbs, Director of Infectious Diseases, Sexual Health and Harm Reduction, Region of Waterloo, Dr. Sharon Ball, Primary Care Physician Lead, Inspector Jennifer Davis, Waterloo Regional Police Services, Nicholas Jonkman, Emergency Planning and Business Continuity Advisor, Waterloo Regional Police Service, Stephen Van Valkenburg, Chief of the Region of Waterloo Paramedics, Ron Gagnon, President and CEO of Grand River Hospital, Karen Lumsden, Vice President, Home and Community Care, Waterloo Wellington Lynn, Vicki Murray, Director of Pharmacy of Grand River Hospital and St. Mary's, and Douglas Bartholomew Saunders, Commissioner of Community Services, Region of Waterloo. The region has been working diligently on our budget plan for beyond COVID-19 for the past few months. Our online public input page is live, and we continue to welcome your comments on engagewr.ca. Next Wednesday, December the 16th, is the public input meeting for the budget. It will be webcast live on our website, just like council meetings, and it will start at 6 p.m. If you'd like to participate as a delegation, you can register to take part on the region's website. The budget plan takes into consideration the more than 630,000 people from across our community who have been impacted by the pandemic. This week's regional enforcement update for December 3rd to December 9th includes tickets issued under the region's code of use bylaw that requires face coverings on our local public transit. These are some of the first tickets issued on our transit system, and the increase in enforcement comes after the last few weeks where we have shifted from our focus from education to also include enforcement. This week, 10 tickets were issued by our enforcement partners, including 4 by the City of Waterloo bylaw. All were $880 tickets for failing to obey an order, 3 to private residences for exceeding gathering limits, and 1 to Sushi 99 in Waterloo for exceeding capacity limits and logs not being maintained. 1 by the City of Kitchener, an $880 ticket for failing to obey an order to a private residence for exceeding gathering limits. 1 by the Region of Waterloo Public Health, an $880 ticket for failing to obey an order to LA Fitness in Cambridge for exceeding capacity limits, and 4 by Grand River Transit, a $240 fine for failure to wear a mask under the region's code of use bylaw. Hanukkah started last night, the first of an 8-day Jewish holiday, also known as the Festival of Lights. I'd like to take this opportunity to wish all those who celebrate the holiday a safe and happy Hanukkah, even though your celebration will look a little different this year. I'd also like to thank Rabbi Moshe Goldman for helping the region to facilitate the placement of these menorahs across our region this year. I'd now like to welcome Dr. Wang, our Medical Officer of Health, to deliver this week's update. Welcome, Dr. Wang.
Thank you, Chair Redman, and thank you for the opportunity to provide an update. So if I start with our overall trends, in the past week, our indicators have improved compared to last week when our indicators were at their highest levels and are similar to where we were 2 weeks ago on November 27th. We still have high rates, and the situation overall continues to be serious and concerning. Our incidence rate is now 70 cases per 100,000 per week, down from 90 per 100,000 per week. We are currently 10th in the province, down from 4th, as other health units' rates have increased over the past week. This will fluctuate, our ranking will fluctuate, but it shows that there are increasing rates in multiple areas in the province. Our current percent positivity, taking into account interim data, is 3.3%, down from 4.1% last week. Our reproductive rate has also decreased and has more recently fluctuated between 0.9 and 1.1. This past week, however, we have seen an increase in hospitalizations and outbreaks in long-term care and retirement facilities. Outbreaks in care homes, hospitalizations, and sadly deaths are lagging indicators, which means we start to see increases in these numbers in the weeks following a rapid increase in cases. So overall, our status is still firmly in the red zone. Yesterday, I issued instructions to workplaces and businesses under the Reopening Act to reinforce and enhance measures that will limit the spread of COVID-19 in these settings. These instructions go into effect on Monday, December the 14th. I recognize this is a challenging time for organizations, and they have had to adapt quickly to implement new requirements and measures. I want to acknowledge and thank businesses for their efforts. I am issuing these instructions because we have seen, as part of the second wave, a significant number of outbreaks in workplace settings that and areas, common areas of concern that have been identified through our outbreak investigations, as well as through the education and enforcement campaign led by the Ministry of Labor recently in our region. Among other requirements, I am instructing workplace and business settings to A, conduct active screening of employees, B, prepare and implement a COVID safety plan and designate a management person responsible for implementing and monitoring compliance to the plan, C, ensuring physical distancing throughout the workplace, including in employee-only areas, and 4, optimizing indoor air ventilation. The full list of requirements can be found on our website. Our holidays and traditions will not be the same this year, but they can be just as meaningful. Please celebrate in person only with the people that you live with. If you live alone, you may join one other household. Celebrate virtually with everyone else. In closing, now is not the time to stop practicing public health measures. It is important that we stay the course. We must continue to avoid social gatherings with those outside our immediate household, limit non-essential trips outside our home, practice physical distancing, wearing a face covering, washing our hands frequently, and avoiding enclosed, poorly ventilated spaces and crowded places. These measures work to protect yourself and your loved ones. Our situation remains serious and very fragile. Due to our high number of cases per day, we are at increased risk of growth resuming at an accelerated pace. For the red measures to have the best chance of slowing our spread, we need everyone to help us. We all have to pull together as a community and continue to dramatically reduce our social interactions. We cannot let up now. Thank you.
Thank you, Dr. Wang. Welcome, Deputy Chief Hilton. You have the floor.
Good morning. Thank you, Chair Redman. It is a privilege to have been chosen to guide the Waterloo Region COVID-19 Vaccine Distribution Task Force as the province of Ontario prepares to implement one of the largest immunization programs. It is imperative that Waterloo Region also prepares to develop a strategy for smooth and rapid vaccine distribution to all residents in a safe and equitable manner. The task force will focus on a number of key areas, including logistics, administration, communication, education, outreach, and security that is in line with the provincial COVID-19 vaccine and distribution task force. The valuable experience and advice of the experts on this task force will inform the strategy and ensure logistical processes are in place, allowing the health professionals to focus on their efforts on the delivery, storage, and administration of the vaccines. The task force will hold its inaugural meeting later today. It is still very early in the development of this program, and there is much to learn as the planning rolls out. Please be patient and know that we are committed to ensure the residents of Waterloo Region remain informed with clear, consistent, and relevant information. Thank you.
Thank you, Deputy Chief Hilton. Now we'll open it up to the media for questions. Joanna, would you like to start? Do you have a question?
Sure. I guess not sure who can answer this best, but just about the task force for the immunizations. How will this be different from delivering flu shots?
Shirley?
Oh, maybe I'll try to answer that. So this is going to be, like Deputy Chief Hilton said, likely the largest logistical undertaking, in Canada, in the province, and here as well. So it's going to be very different. We have, at least with the initial vaccines, there are logistical issues that will need to be taken into consideration, like the fact that the Pfizer vaccine needs to be stored in an ultra cold freezer, and then at this point in time, it can't be further moved to other places. So, it's going to be. We want to be able to roll out the vaccines as quickly as we get them and roll them out in a safe and efficient manner. So there's going to be lots of moving parts that we'll need to coordinate well together to be able to make that happen. And that's why I'm so pleased that that there'll be this task force led by Deputy Chief Hilton.
And Joanna, if I could just add, I mean, if you look at who is on the task force, I mean, one of the people is Karen Quigley-Hobbs, who is our key person for rolling out vaccines in a normal flu season. So we know there's a lot of expertise on that panel already, despite the fact that this is a formidable challenge. Do you have a supplementary question, Joanna?
Yeah, I guess the release talked about priority groups first, but do you guys anticipate that there's going to be some, I guess, unrest among sort of the general population who are also very eager to get vaccinated?
Yeah, we understand. That's why we also have to be clear in our communications so that, the right expectations are out there. In the first couple of quarters, or at least in the first quarter of 2021, there will be a very limited amount of vaccine that will be available. And so as the provincial government has determined in consultation, with the National Advisory Committee on Immunization, the province will be reserving those very few initial doses for the highest risk populations, such as, those who are in long-term care and those who provide care for those in long-term care. They'll be among the first groups to receive the vaccine. We expect that starting in Q2, there'll be a little bit more vaccine to be distributed, but we don't anticipate, the governments federally and provincially don't anticipate that we'll have a sufficient supply to really open it up to the general public until Q3 of 2021. So I think, it will be important for us to communicate that information so that, people, as much as they'd like to receive the vaccine earlier, know that it is coming, but that will be a proceeding based on supply, and that, there will be groups as set by the province to try to make it as risk-based and as equitable as possible.
Kate, do you have a question?
Yeah, I know Deputy Chief Hilton said we need to be patient.
Mm-hmm.
I did see where some hospitals in Toronto and Ottawa are getting the vaccine as early as next week. Have we received any word as to when the region can expect those very first doses for those high-risk individuals?
Who'd like to take this?
I don't know if you've received anything, Shirley. I don't think other places have. I think we understand that the province had previously determined that Toronto and Ottawa, for the reasons I think General Hillier might have outlined yesterday in the provincial press briefing, would be getting those initial doses and the vaccinations would be starting there first. We anticipate very soon hearing more about other sites in the province that will be getting their first doses. I don't know if Shirley has heard anything since this morning, but I haven't.
I don't know. I saw Mr. Lauckner unmute. Do you have anything to add, Bruce?
We haven't received defined timelines, although we have been told to get ready as the municipalities across the province. So we do know, as Dr. Wang said, that refrigeration units, as an example, will be coming shortly. Shirley and team are working to identify the logistics around that. Location has been determined, and we will be operating in a matter of days and weeks again. So very similar to the beginning of the pandemic when things happened very quickly. We're not talking months and years. We're talking days and weeks, and are preparing for that and preparing for distribution of a small amount, potentially as early as the end of December. But as Dr. Wang said, it will be limited quantities right through the first few months of 2021 and very targeted.
Kate, do you have a supplemental?
I do. And Bruce, you kind of touched on it there. I mean, in terms of getting ready for this vaccine and needing to get the freezers that can handle the Pfizer vaccine, like what kind of infrastructure is the region looking at needing to bring in that you don't already have for the vaccine rollout? Yeah, so that's one of the reasons why we made the decision to create this task force early rather than waiting. And Deputy Hilton has certainly been working over this week with her counterparts across the province to determine exactly what's needed. The hospitals have been notified. We have on the task force as well, public health, as you've seen, home care, our shelter system, community care, primary care, all to get to the bottom of exactly what's needed. But I'm pretty confident that within a week, we will have many more answers to those questions. And from what I understand, we have existing infrastructure that is appropriate to receive the vaccine. We are focusing our efforts then on the distribution
And a key piece of that is education and working with communities. There will be some concerns amongst different communities and amongst different residents about the vaccine. And we want to make sure that everyone is well educated. And then we work very closely with all 630,000 residents to make sure that everyone gets the vaccine who is able.
Okay, so my little matrix just shifted. So next up is Nicole. Nicole, do you have a question?
Hi, good morning. You talked about infrastructure. I'm just wondering if we can expect one of the 3 area hospitals to be chosen as the inoculation center, similar to what's going on in Toronto and Ottawa.
Yes. Dr. Wang, do you want to speak to that or do you want me to?
Sorry, I didn't hear what she said. My thing went out. Could you answer that, Bruce?
So the question was, has one of our area hospitals been chosen? There are 21 hospitals in the province and one of ours has been chosen, as far as I understand.
My next question has to do
with.
with.
Sorry, Nicole. Dr. Wang, could you hear that?
Yes, I was able to hear that. Thank you.
Yes. And can we confirm which hospital it is, or is that still in the process?
I think that's still in the process of being confirmed. It's all rolling out very quickly, though.
Okay.
Sorry, Nicole.
Nicole, your second question?
Yeah. I'm just wondering in regards to the contact tracing issues that you talked about last week.
Yeah.
You know, an outbreak was declared at the University of Waterloo today, but it seems as though some of the dates, you know, in terms of when this person tested positive and then when the outbreak was declared, the dates are about 3 or 4 days apart. I'm just wondering if that's an indication of the continuing struggles, or has that improved?
Yeah, thanks for the question. No, the changes to our to our case and contact management, whereby, you know, in lower risk situations, we're asking cases to notify their own contacts, or asking, you know, organizations like universities to proceed with assisting us with contact tracing. That has not had an impact on the declaration of this outbreak. Sometimes it takes a bit of time to actually link cases and determine that there is evidence of spread at a particular site that would lead that site to be declared an outbreak. So that can happen. That's why sometimes you will see outbreaks that are declared and then a few days later they're declared over. It hasn't been like 14 days or anything, but because just sometimes by the nature of you know, the way that cases arrive and then are linked together, it can, and it's not always immediately evident, but it's not this outbreak has not, the declaration has not been delayed due to changes in our case and contact management, which has yeah, it continues to improve. We're I can't remember the exact number, but we're regularly above 80% now, but we still have a lot of cases coming in on a daily basis, and you know, the investigations are still quite complex, and so you know, we're continuing with our prioritized case and contact management process that we put in place last week.
Thank you. Irene, do you have a question?
Yes, I have a 2-part question, but I'll ask my first part first. Last week, Dr. Wang, you mentioned that on the monitoring map that air would no longer be white, and it is white. I just wondered if you know why it didn't change?
Yeah, it hasn't been updated yet, but it will be updated early next week. Sorry, it's just taking a little bit longer than I anticipated to get the technical aspects to work properly.
Okay.
So it should be updated early next week. Yeah.
Okay, that's great. And my second question is about the township rating on the monitoring map. According to the monitoring map, it says we have roughly 30 cases that's outside air, but still in North Dumfries Township, as well as 7 outbreaks. And yet when I look at the outbreak section, I don't see anything in North Dumfries. So I just wondered if there's a further explanation for that.
I think you may be speaking about number of cases that are linked to an outbreak. Yeah.
Oh, okay.
So those are people who reside in North Dumfries, but could be associated with outbreaks at facilities that are elsewhere in the province. Elsewhere in the region.
Okay, all right, that explains it. Thank you.
Thanks.
Damon, do you have a question?
Yep. So my question is, in terms of vaccination education, sorry, my phone's just going off. In terms of vaccination education, what's the plan of the task force? How are they going to reach out to get the message of truth to the residents of Waterloo region?
Deputy Chief Hilton, do you want to answer that?
So I don't have the answer, unfortunately, to that yet. We are having our inaugural meeting this afternoon. So this is all part of our logistical planning as it relates to the task force itself. So stay tuned. We don't have that answer today, but we will, and certainly be letting the community know what the plan is.
Perfect. And then my second question, in terms of the Section 22 that was placed on the Mennonite communities, what is the update in that situation?
Dr. Wang?
Yes, thanks for the question, Damon. So we have gotten a good cooperation since the section orders have gone in. We very much appreciate that. So we've gotten, we are working, continuing to work very actively with the leadership and the members. So far it's going well.
Okay, Tim, do you have a question?
Yeah, I do. Dr. Wang, yesterday you did a takeover at Laurier's Instagram account. I just wanted to ask, what were some of the things that you told the students and staff about what to be worried about when it comes to the holiday season? And is there any tips that you have for college students that are living here in Waterloo Region, studying in Waterloo Region, and then are planning on going home?
Yeah, thanks for your question. I'm sorry, I didn't quite make out the end of it because of seems like my connection is a little bit spotty, but I think I got the gist of your question. So students are a really important part of our region. They play a very important role in our efforts to try to slow the spread. And I know that they really want to do what they can as well. So basically, it was letting students know what they could do to continue to help protect one another. And there were, as I understand it, questions about students traveling over the holidays. And in general, our advice to students is the same as to other people, and that we don't recommend non-essential travel. We also don't recommend that people in red zones like ours go to areas of the province that are in orange, yellow, or green. But we also understand that some students will be making some trips that they deem essential back home. And so we're asking them really to, again, adhere to the precautions before and after their trip. So, for example, before they go, really stick to only their household contacts, in this case, maybe their roommates. Try to really minimize any interaction with other people, just like we're recommending for everyone. And when they do get home, again, really minimizing to the extent possible their interactions with people outside of their immediate families, especially with those that are at greater risk, immune compromised, older, for example, to the extent possible, again, just trying to minimize those non-essential social contacts and trying to get together with people virtually. Thank you.
Tim, do you have a supplemental?
I do. We probably mentioned this in past meetings and stuff, but when you mentioned in your opening remarks about if you're alone, you can be with another household. Do they have to self-isolate before they go into that household? I just forget what they have to do prior to going into that household.
Yeah, no, they don't have to self-isolate. They may choose to do that, but really the recommendation is if you're going to join a household, assume that you're now part of that household. So it's an exclusive household. You're part of that household. They're part of yours, so to speak, and you together form one household, and then that's it. Stay together, and make a commitment to each other to, in all their other interactions, adhere to the public health precautions that are recommended, so that they don't introduce greater risk into that household.
Thank you, Dr. Wong. Does anybody have another question? Kate?
Thank you. Dr. Wong, I wanted to ask, we saw in Windsor where public health closed the schools early.
Mm-hmm.
We have seen more cases and outbreaks sort of in Waterloo region. So I'm wondering what your thoughts are on the outbreaks that we've seen in the schools locally, and what would be a step you'd be willing to take.
Mm-hmm. Well, thanks for the question, Kate. So, yeah, the school situation in Windsor is quite significant. They've had I think at least one major outbreak in a school. I think they've had another one they've had to close down due to spread in the school. And their rates have really skyrocketed. I don't know how to put that in any other words. So, there's a very, very, very serious situation in Windsor, Essex in terms of the spread. And I think the medical officer of health there felt it was important then to switch the learning from in-person to online. As much as possible, we are trying across Ontario to keep the schools opened. And here in Waterloo region, what we've seen is, like I think I've mentioned previously as well, we are starting to see more cases that are diagnosed in students and staff as a result of the general increase in spread in Waterloo region. But the outbreaks that are occurring in the schools and the spread that's occurring still remains relatively limited and controlled. And so, at this time, I'm not recommending anything different in terms of actions. The more that we as a community can reduce our overall rates of transmission, the more that the numbers of cases that are students or teachers will go down. So what I'm recommending for us as a community overall would be the best recommendation I would have for schools at this time. That said, we know this is something we need to continue to monitor, whether it's schools or care homes or workplaces. And so it's something we will continue to monitor and work with the school boards on.
Okay, Nicole, did you have another question?
Yeah, my question is for Deputy Chief Hilton. These vaccines are highly valuable. I'm just wondering if you're able to quantify how many perhaps police officers will be assigned to help with the security and transportation into, a centralized place like at one of the localized hospitals.
Deputy Chief Hilton?
Thank you. I can't quantify it this time. However, security is part of one of our considerations when we look at strategy. So certainly the province will have their security plan, but depending on where and when we have a site identified, we will be working with not only local security, regional security, but certainly planning with the regional police. We are obviously monitoring as it relates to any potential threat, whether that be through, we have to consider, cyber threats in addition to organized crime threats. You've mentioned that it certainly is something that will be, it's a commodity when we start looking at vaccines. And so that is something that we have to put considerable effort and strategy into what that security plan looks like. But we're right into the very infancy of the regional planning. So don't have an actual number to quantify for you today.
Joanna, did I see your hand for a second question or a supplemental?
Yes, question for Dr. Wang. You brought up Christmas again, and I've heard many people, despite the clear advice on how to celebrate Christmas, saying that they're going to go ahead and celebrate with their families anyway. What would you say to those people?
I would say that, they run the risk of introducing COVID to their friends and families. And this is a real risk. And I would just ask them to reconsider and to, understand that while it's not what anyone wished for, this is the best way to keep our loved ones safe. The spread of the spread of COVID in Waterloo region is widespread at this point, and they really are running the risk of introducing it to their loved ones and to their families. This is the best way for our red restrictions to work and to not have to be in place for that long is for all of us to work together and adhere to those recommendations. That's the best thing that we can each do for our loved ones and for our community overall. Thanks.
Irene, did you have another question? Okay, Damon?
With the holidays coming up, in terms of enforcements, what can we expect the Christmas weekend?
So Dr. Wang, do you want to jump in?
No, not really, but I can jump in if you'd like.
I would tell you that we will still have people at work. We provide essential services. We will continue to use education, but also tipping towards enforcement. I think a lot of our tips are complaints from the public. I think they'll still be followed up on. Is your question if we're going to let anybody have some couple days off over Christmas? I don't think everybody will be off. I don't know if Dr. Wang or Mr. Lauckner want to comment on that.
I think I'll just add that, our enforcement partners, they plan to be quite active. But of course, there will be people that will have time off as, to be able to rest and such. But there's no plan to ease off education and enforcement activities during the month of December.
Tim, do you have another question?
No, I'm good. Thank you.
Okay. Oh, Nicole. Okay. Just because it's almost Christmas, Nicole, do you have a fourth question?
Yes. Yesterday we heard about provincial modeling numbers. I'm just wondering if you can provide us with any local modeling projections this week.
Shirley, you're on mute.
Sorry, I don't have any numbers, but what I can tell you is what the provincial projections laid out is, we're at a very precarious time in Ontario because there still seems to be some growth, especially, in the lockdown and red zones. It's not rapid growth overall, but it's still some degree of growth. And so I think that just tells us that we really, again, we can't only rely on the, provincial restrictions that are in place. All of us as a community, each one of us has to also do their best to try to reduce those social interactions, which is what those restrictions, are in place for. And that's really going to allow us to start to bend the curve and then start to see cases go down. That will take a while, but it's the only way to achieve that, because what we're still seeing in the province is some degree of growth. And so, it's better than it would have been otherwise, right? Because you may remember that before those framework restrictions came into place, before those places in GTA went under lockdown measures, etc., the growth was such that we were looking at 6,000 cases a day in Ontario by mid-December. Here in the region, 260 cases by day. So the fact that those restrictions have gone in has actually made a very significant difference on where we would have been had we not had those restrictions. But in order for us to have an impact on actually flattening the curve and then having it go down, we have to keep up with our efforts to dramatically reduce our social interactions. And the way that we can do that is through our non-essential interactions, right? Through no more social gatherings, in particular during Christmas, and only going out for essential purposes. So that's the way we're going to be able to change the trajectory from a continual slow rise. And I guess that would be the key thing that I would say about yesterday's projections.
Any further questions? Kate?
This isn't really a question, but just, well, sort of. Looking ahead, obviously we'll have hopefully the briefing next Friday. I'm wondering, because the following Friday is actually Christmas Day, and I'm not sure anyone wants to be doing this. If it's possible to do one on the 23rd. I realize you can't answer that now, but I'm just sort of putting the bug in the ear that it would be nice to have one more between the 18th and the actual holiday, if possible.
That's under active consideration, Kate. So it's something we too have thought of. We figured you all deserve Christmas Day off as well. I really want to thank Deputy Chief Hilton for spearheading this mammoth task. It's a very impressive team. And I guess other than saying happy Hanukkah to everyone celebrating it right now, the other thing I would say is welcome news as this vaccine is, and as much as we know it's going to have an orderly rollout, we have an A team here to make sure it happens. We will still have to adhere to our public health guidelines, because this will not be like switching a switch. And what we have to realize that in the absence of being able to flip a switch, we will have to stay home, get tested if we have symptoms, wear a mask, wash our hands, and stay in our household if we want to come out of this quickly. So those things will still need to be in place. I think it was Deputy Hilton that was saying about the third quarter is probably when we will get a broader spectrum of vaccines for those who choose to get the vaccine in the public. But we still need to follow Dr. Wang's guidelines and those of public health. I don't know, Dr. Wang, if you want to comment.
No, thanks very much for commenting. The only thing I would add is the other thing in the provincial projections that they showed is, what we've seen in our region, right? There are multiple hospitals across the province that are struggling because of more and more people being hospitalized and having sometimes outbreaks in their environments as well, which is, can be expected when you have a lot of COVID cases. And so that's another reason for us really to adhere to the precautions to protect ourselves, our loved ones, our families, but really to prevent the healthcare system from not being able to keep up, which will have widespread repercussions. Thank you.
Thank you all very much. Again, thank you. We will get back to you with the next update. Kate, thanks for flagging that. And everybody stay